Hey class, wanted to jump in this week and talk to you for just a few minutes about treatment planning regarding choosing effective treatments for your treatment plans using theory and incorporating the Townsend model. I had a couple questions this week and I want to make sure that you guys all feel confident and competent going into the next weeks as you're doing treatment plans as well. When you have something like the Townsend model that is still in development and that is based on other theories, it can be really difficult and frustrating to try and incorporate those into your treatment plans, especially with the emphasis on using evidence-based treatments and practices. I want to clear up a couple things though and make sure that you guys understand what we're talking about when we say evidence-based treatments and practices. It doesn't necessarily mean that with every client you're going to say, okay, well, you have depression, and evidence-based practice says that CBT is the main thing that works with depression, so I have to use CBT on you. When we talk about evidence-based practices, we talk about building counselors who go to the literature and look at the things that work with certain disorders and don't just sit in a room with a client talking to them, trying to figure out if maybe they can think of something to do to help. So as you guys are looking for treatment models for these case studies, remember that these are two-dimensional case studies. It's going to be really hard to try and justify in your own mind that you've got the right treatment for this when you have a very brief case study and a two-dimensional approach. Remember that this whole process of your master's program is building skills a little bit at a time. Right now, we're getting the structure down for these treatment plans. So as I'm going to look in, I'm grading your first round of treatment plans today and tomorrow. As I'm looking at them, I'm not looking and saying, well, is this done, absolutely perfectly? If this was a real client, would this be exactly what we would do? I'm looking at your thought processes. I'm looking at the way that you are engaging with the material. We're building the primary building block skills so that you can do this well later and incorporate as you learn more about theory. I'm not as concerned about it being a specific theory or specific objectives. I need to see that you can align this. So even if, let's say, I would look at something and I would say, hey, I would think that, I think that cognitive behavioral therapy would be the best version for this. If you have that you're going to take it from a Gestalt perspective and you give, information about the empty chair and things like that or whatever it is, and it aligns well, I'm going to consider that effective. I might give you feedback in that so that you can grow it over the course of time as you're rerouting your treatment plans, as you're going back and growing with it. But I want you guys to kind of step out of the box of feeling like these treatment plans are about getting it exactly right and really dive into the developmental process of this. There is, with the Townsend model and that aspect, there are a couple of places that you can incorporate this. We talked about it on the second week's class time. You can incorporate the Townsend model into the contextual analysis and look at the client's their engagement with attachment and separation and integration in adulthood. You can incorporate things in goals in your treatment plan to address those things in the client, but know too, these case studies weren't written for someone to assess those 4 items from. They are written as very basic, symptom-based treatment plans to give you a guidepost to know what you're looking at. So any incorporation of that is going to be good for you to practice. It's not going to be clear-cut though. It's not going to be cut and dry for you to say, okay, well, this is what they're struggling with and this is what they're doing. You don't have enough information for that. If you were actually assessing this client, you would be able to get that information, but you don't have the ability to do that. So one, know that you can take a little bit of creative liberty if you'd like to insert some information that would support information about the Townsend model in whichever place that you choose to incorporate it. But that's a really good thing for you to do too in terms of figuring out where it fits for you and where you see the Townsend model incorporating into this. The Townsend model is not something that exists only in and of itself. Like you all know, it's been pulled from a variety of evidence-based practices. I have a list of 9 of the cutting edge areas that Scott Macon and John Townsend say this is pulled from with names and dates and things like that. I'm going to pull that, and I'm actually going to post it in the classroom for you to see as well, so that maybe that will help give you some places to go. But know this, I really don't want you in this class to get hung up on spending hours and hours trying to find the best treatment. Remember the objectives. The objective of this class is for me to see that you can align a treatment plan. It's not to make sure that you know all the theories and everything that you need to do. So I hope that that's been helpful. If you have more questions about this, please feel free to keep emailing me and asking me. I'm happy to talk about this as much as we need to, so that you guys feel comfortable with it as we move forward.